Hi, I'm Dr. Amber Allen, and something that's commonly misunderstood is what's referred to as TMJ by most people. TMJ actually stands for temporomandibular joint. So it's not the condition, it's actually the joint, but people just say, I have TMJ, if they have problems in that joint. It's basically where the top of your mandible rests against your skull with a cartilage disc in between. And problems in the joint manifest as jaw clicking and or pain, muscle tenderness, headaches, and even shoulder and back aches, tooth grinding and clenching, and even tooth wear. So it's a really complicated joint. Not only is it affected by bone and muscle and soft tissue, but also the teeth. And the teeth aspect is often overlooked, but a trained dentist is especially aware of it. The way that your teeth fit together has a huge impact on the health or deterioration of the TMJ. And it is a deteriorative process as that joint complex breaks down over time. TMJ deterioration is not reversible, and as it progresses through the stages, it gets harder and harder to fix and more of a involved process. So it is important to look at it in the early stages before it hurts and before it's popping or clicking. And really, a dentist should be checking that out on every new patient. In our office, we evaluate for TMJ problems at that new patient exam and then kind of keep our eye on them when you're coming in for your checkups. We use a series of diagnostic aids and measurements to look at the TMJ and the muscles. Treatment, if there are issues in the TMJ, treatment varies from just a simple a night guard basically that's worn at night, but it's not just a fit over your teeth night guard like the kind that you would buy at the drugstore or something. This is a custom made night guard made off of models of your teeth. Those models are put on what's called an articulator. It kind of simulates how your jaw opens and closes and how the teeth slide against each other. And we basically build an ideal bite into this little piece of plastic. So when this is in at night, you have a perfect bite. So 8 out of the 24 hours, your jaw joint is protected. And your muscles aren't pulling on that cartilage disc and stretching the ligaments and making the TMJ problem worse. So this is kind of the easiest thing that we can do to keep things happy in that jaw joint complex. Occasionally, we will take it a step further and actually adjust the teeth themselves so that all day long, 24 hours a day, your jaw joint is happy and you don't have to worry about ending up with lockjaw or major TMJ pain. Ways that we can make the teeth and the bite, perfect, so to speak, so that the jaw joint is healthy. Varies from just a simple equilibration or adjustment of the tooth surfaces. And when I say adjustment, I mean like fractions of a millimeter. We're not taking much of that enamel off, but we're basically perfecting the way that the teeth hit and slide against each other. And that, again, keeps the muscles relaxed so that they're not pulling on that cartilage disc and making the jaw joint problem worse. Other things that we can do are crowns on the teeth, resin bonding, and even Invisalign in some cases, just depending on what the case is. How far off the bite is from being perfect, and you just don't know that until we get those series of measurements in the dental chair. So if that's something that you're worried about, or if you have more questions about it, please give our office a call and we'd be happy to help you evaluate and keep your TMJ healthy.